Minister calls for collective response to tackle HIV. The alarming rise in HIV cases among the youth has prompted an urgent appeal from Women and Children Minister Linda Tabuya. Following the alarming statistics revealed by the Ministry of Health, Tabuya expressed deep concern over the escalating number of HIV infections, particularly among teenagers, driven by the misuse of drugs and unsafe sexual practices. While highlighting the disturbing trend of Bluetooth, Tabuya says that children and teenagers are particularly vulnerable, not only to the health risks associated with the practices, but also due to their involvement in drug trafficking. We have a couple of cases that we're dealing with of teenage boys that are having to live with HIV because of Bluetoothing. This is becoming a crisis, and I appeal to adults who are using children to be drug mules, who are using children to transport these drugs. They are not educated enough to make the right decisions when it comes to these drugs. So please, stop peddling children to be drug mules. Tabuya is calling for a collective response from the community, stressing that the government cannot combat this crisis alone. To our adults who are consuming this, it's obviously very bad for them, but the case of HIV is directly related to the amount of drugs that are being used in this country, and so it is affecting our teenagers, it's affecting our children, and this needs to stop. Fiji has recorded 552 new cases of HIV in the first 6 months of this year, with 73% of the new cases in individuals less than 39 years of age. According to the Ministry of Health, 137 new cases are in the 20 to 24 year age group, 128 or 23% are in the 25 to 29 year age group, and 9% or 50 new cases are in the 15 to 19 year age group. This trend is due largely to achievements in Eastern and Southern Africa, where the annual number of children acquiring HIV fell by an estimated 73% between 2010 and 2023, the authors say. There is, however, a need to increase intervention efforts in other regions, such as in Western and Central Africa, where progress has been slower. Some countries on the continent are proving to be steadfast in creating a blueprint on how to effectively use public sector resources and plan to eliminate vertical infections. Namibia, for instance, in May received a bronze tier certification from the WHO for reducing mother-to-child transmission to less than 5%. The Southern African country avoided 28,000 vertical transmissions in the last 20 years, leading to a 70% reduction in vertical transmissions. Botswana has also in the past, 2021, been lauded for being on track to eliminating mother-to-child transmission of HIV. Besides the reduction in new transmissions, the report also underscored the success in access to treatment options for existing cases. More patients are now accessing free antiretroviral therapy offered through the public health sector. In 2023, almost 3 in 4 adults, 73%, 66 to 81%, living with HIV globally had a suppressed viral load, a big improvement compared with the 40%, 36 to 45%, in 2015, the report says. This has more than halved annual AIDS-related deaths, dropping from 1.3 million in 2010 to 630,000 in 2023. In Africa, the Eastern and Southern African region has seen a 57% drop in the number of AIDS-related deaths between 2010 and 2023. Other regions seeing equally commendable progress in averting deaths include in the Western and Central African region, where the decline reached 55% in 2023, while Middle East and North Africa saw a 6% decline in AIDS-related infections. Eastern Europe and Central Asia witnessed a 34% rise in AIDS-related deaths over the period, while globally the 2025 prevention target goal of having 95% of people at risk of HIV infection having access to and using effective prevention options remains out of reach. The global HIV prevention response is proceeding at an encouraging pace. In Africa, the availability of diverse prevention methods provides unparalleled flexibility, encouraging individuals to adopt at least one form of prevention. With more options now than ever before, people can choose the method that best suits their needs, thereby enhancing overall participation in preventive measures. Condom use remains the most effective low-cost HIV prevention method. Household survey data suggests about 36% of adults in Eastern and Southern Africa and 25% in Western and Central Africa used a condom at last sex, Other recent preventive options gaining ground in Africa include injectable PrEP, which was in February 2024 rolled out in Zambia, making it the first country on the continent to authorize its use. Despite significant progress in preventing new HIV infections, experts are alarmed by the shrinking funding for scaling HIV prevention. Among the most affected populations, the report details that in 2023, total resources available for HIV, $19.8 billion, dropped by 5% from 2022 and were $9.5 billion short of the amount needed by 2025, $29.3 billion. According to UNAIDS Executive Director Winnie Byanyima, political willingness among leaders is critical as it can save millions of lives, prevent millions of new HIV infections, and ensure that everyone living with HIV can live full, healthy lives. Whether leaders fulfill their pledge to end AIDS is a political and financial choice. The time to choose the right path is now, Byanyima said during the launch of the report.